Trick or treat. If you see me here on YouTube, you see that I am carrying two Halloween activities from my SIS membership. Why is this on the podcast? No, this is not a fluff episode. I do not do fluff episodes. I'm not a fluffy type. I'd like to talk about serious business issues. And this is a serious business issue. We are actually going to discuss the holidays and why the holidays are such a great topic for speech therapists to capitalize upon. When I say holidays are great to capitalize upon, please do not take that as a license to take your own religious holidays and stuff them down your students' throats. No, you want to explore many different holidays and you want to be diverse in your approach, of course. I consider Halloween pretty secular. I know some religions consider it to be pagan, but for the most part, it's a pretty exciting holiday. And in my SIS membership, for instance, every week of October, I have included spice and everything nice that is Halloween related. And there is a very important reason for that. So, I do everything based on the research. I always have numbers to share with why I'm doing what I'm doing. I don't do things because it's cute. I do things because they're fun, because fun really matters when it comes to learning, especially if you're working with preschoolers. However, there's always a lot of substance to my activities, and this is why Halloween has a lot of substance to it. I'm going to give you a little bit of background. We're going to talk all about research, roll up those sleeves, and dive in so you understand your why. Why are you doing Halloween activities in the beginning of October? And why you're doing activities throughout the entire month is because the research indicates that when you talk about important upcoming events like that are in the near future, we're not talking about next year's birthday. We're talking about the birthday party this month. We're talking about Halloween that's happening this month. What that does is for children at the preschool age, the research indicates is that you're going to get language that is going to be more diverse in vocabulary. You're going to get language that is longer and more complex. And that's because you're not discussing the here and now, you're discussing an outside event. So this could either be you discuss Halloween a couple days after Halloween and what happened on Halloween or what happened at the birthday party, or perhaps you're discussing what's going to happen on Halloween. Either way, you're outside of the present and the here and now. So when we're in the present and the here and now, we're very redundant in our speech. And we use a lot of what's known as deixis. We're using a lot of here, there, that, this. Like if you ever look at a core board, it's like, oh, this is all we really say? Yeah, when we're talking about the here and now. A core board won't get you very far if you're going to be talking about the upcoming Halloween party. But that is what happens. So you have this increase in richness in your language in terms of vocabulary, grammar, and syntax. But on top of that, we're not just treating a mouth here, we're treating a child. And I think that the research I'm going to share with you today is actually going to take it up a level in thinking about improving the child's executive function and improving the child's internal locus of control, in which the child knows that I'm in charge of whether or not I'm successful. What we know is that children with communication deficits in these two areas, they're statistically significantly more likely to have difficulty with executive function and difficulty with internal locus of control. They're more likely to have an external locus of control. Like no matter how hard I try, it's going to be based on luck or what someone else thinks or does. I have no control over the outcome. That is why talking about Halloween is so important throughout the month of October. And not only are we talking about it, we're doing every week hands-on fun movement activities about Halloween, because what we're doing is we're more than just eliciting richer language, we're also eliciting richer thinking. This is very important, and this is a word I don't think you use in your vocabulary if you're a speech pathologist, and I want to add it to your vocabulary. And the word is called prospection. So, prospection is a word that you can think of kind of like what are your prospects, where you're thinking ahead into the future. and what you could do and what you could not do and how that's going to change the outcome. So, what the research has found is that as early as 2 years of age, children start thinking about the future and start thinking things could happen, or they could not happen, or they might happen, or they might not happen. They start thinking about tomorrow. And that is a really wonderful thing because prospection is, according to this article, and I'm going to make sure to cite it for you, is the ability to plan for and envision one's future self. It's an important cognitive achievement that improves your ability to plan, delay gratification, and to achieve goals. So let's backpedal. I know it sounds like fluffy, flowery language, and I appreciate you sticking with me through the fluffy, flowery language. With first, we have the fancy word, prospection. And then we have what is the definition of prospection? And then there's just more fluffy, fluffy, fluffy. But think about it this way, the ability to plan, executive function, maybe that comes to mind. The ability to delay gratification, inhibition, executive function, does that come to mind? And the ability to achieve your goals, take them to completion, executive function, does that come to mind? So, this idea of improving prospection, we can think of it as synonymous with the ability to improve the executive function. Now, that obviously is going to have to come with internal locus of control because children learn that, okay, there's something that's going to happen in the near future, and I get to make decisions as to what that outcome is going to be. I'm in the driver's seat as to what costume I'm going to wear, where I'm going to go, what I'm going to eat. I get to plan it and then I get to carry it out. I'm in the driver's seat. So, Halloween is a really wonderful holiday for you to embrace in your speech language therapy activities in treating the whole child, in which you're not only fostering richer speech and language development, you're also fostering a richer heart, mind, hand connection, in which children are able to dream or think about possibilities. And then they're able to use their minds and plan out those possibilities. And then they're able to take action with their hands and make these things happen. So, this is very much executive function. This is very much internal locus of control. This is exciting stuff. This is what it looks like when you're not treating a mouth, when speech and language therapy is taking a more integrated approach and you're treating the whole child. You're not doing empty drill and kill where the child is saying multisyllabic words. Say jack-o'-lantern, say pumpkin pie, say happy Halloween. Well, that's nice. And I've got my clicker and I'm going to count the number of multisyllabic words you say. We can do better than that. We can do activities in which we're actually discussing the future holiday. And when we're discussing that near future holiday, not future holiday, near future holiday, right? We're not the stores. We don't go 3 months in advance. We're in the month. We're there. It's coming up. What happens is we're not only treating the child's language delay, we're not only treating their speech delay, you are also treating executive function, you're also treating that internal locus of control. So, this is why I say Halloween is serious business. So, go ahead and celebrate Halloween. And of course, I want you to do so mindfully. If you have participants in your program do not celebrate Halloween, that look at it as a pagan holiday and that have objections to it, you're going to have to change things up and think about the next big event to celebrate instead. There's always some big event coming on. Valentine's Day, perhaps. Thanksgiving, if you can get away with that. But once again, I encourage you to take these big events very seriously. And in doing so, you're going to make your therapy much more educationally rich. I apologize because this episode is shorter than a typical episode. And the reason for that is this month I actually have 4 presentations. 2 of the presentations I'm doing for ASHA, and the other 2 are full day presentations. I'm going to be doing one for Texas and one in Brentwood, California. But what I wanted to share with you is to take Halloween seriously, to have a ton of fun. And I want you to roll up your sleeves and make the world a better place, one child at a time. You will always be first.